Hi, everyone. Welcome to the SAEM Research Learning Series course online lecture titled, I Have My Data, Now What? Drafting Your Manuscript. It is my pleasure to introduce to you Dr. Joshua Davis. Dr. Davis is an emergency physician in Wichita, Kansas, who teaches as a clinical instructor at University of Kansas School of Medicine. He completed his residency at Penn State Milton S. Hershey Medical School, completed medical school at Thomas Jefferson University, and received his undergraduate degree from the University of Delaware. His research interests are broad and include emergency medicine clinical topics, along with patient safety, handoff communication, and diet and exercise. He has published over 50 peer-reviewed articles, given multiple national presentations, and written several book chapters. Dr. Davis, I will now turn it over to you.
Thanks so much for that lovely introduction, John. I really appreciate it. So we're going to get started here for the research learning series. I'm going to talk to you a little bit about what many people consider one of the most frustrating parts of research, but what I find really rewarding, which is actually sitting down and writing and drafting your manuscript. So I have no disclosures, but I'm always looking for some if anybody is offering. Our objectives today, we're going to discuss steps for preparing to write a research manuscript, understand the IMRAD format, and list 3 tips for getting a research manuscript accepted for publication. A little bit of an overview about what we're going to talk about. We're going to do a section on literature review, a section on journal selection, section on how to get pen to paper, and then I'm going to give you some of my personal tips and tricks for writing, and then talk a little bit about what's next. So our first section is on the literature review, which is probably, and I won't even say probably, it is the most important part of writing your paper. There is a whole separate research learning series presentation that's going to be on the literature review, so I'm not going to cover that in great detail. Hopefully, you did a literature review before starting your project. And at some point for writing a protocol or an IRB submission, you also presumably did some literature review, which is helpful, but I will kind of stress that this is a rinse and repeat type process where you'll have to do it a couple times. And initially when you're doing your research and designing it, again, when you're starting to write, and then again, after you have all your results, you'll want to revisit your research literature review. There are a couple questions that you'll want to consider when doing your literature review. One of the most important is why is the research needed? And then you'll also want to address how your work is novel and what's been done before. And then once you have your results, you'll want to look at why are your results important? How do they fit into other research that's been done in the field? And why would others want to read it? And that's an actually really important that I want to stress is a lot of times people get into very niche research and they are very excited about this, for example, one protein that they're researching. But if you were to write an article about your favorite protein that you've spent your whole life researching, I may not necessarily want to read that unless you can give me some clinical reason or some benefit to that. And so it's really important that you bear in mind when you're writing the concept of why does somebody else want to read this and not necessarily focus on your passion for whatever topic you have. There's 2 main parts of your manuscript that are going to be devoted to or benefit significantly from your literature review. And that's going to be your background and your discussion. And so some of these questions fit really nicely into writing your background and your discussion section. So for the background section, the overarching question here is why is this research needed? And so hopefully a lot of this literature review was done prior to starting your research. And so hopefully you just have to revisit and make sure that there's nothing new that's been done on this since you did your initial literature review. And you don't have to start from scratch to redo that literature review. It can be a brief update. There's 2 kind of approaches to writing a background. If you are a well-versed expert in the field who feels like you know all of the literature on the topic in the specific field that you're writing about, you can do what I sometimes do, which is write your paper and then find the evidence that you know exists to support that section. I suspect that many of you listening to this are in a different camp where you are experienced in the field, but are maybe not, would not consider yourself expert and super well-versed in the literature. And so then you can take the more traditional approach, which is gathering and summarizing articles. I do recommend that you write an annotated bibliography just for yourself to review. And that's when you take those background articles that you've obtained and write yourself a couple sentences about the results or implications of the articles and how you might use them in writing your background. You will most likely end up with a significant amount of articles and not end up using all of them to write your background, but it'll help give you a foundation for writing that. And this is where it's really important to note the benefit of using primary literature. So review articles are nice to help direct you and help you see what others in the field are thinking, but should really not be used very often in citing in background or literature review or scientific publications, unless you're trying to cite somebody's opinion. You really want to go back and dig down and find the primary literature. One of the problems with that can be that something gets perpetuated over time in one review article and another review article and another review article, and it may have changed or morphed like when you played Whisper Down the Lane as a child, and over time what the foundation is actually gets changed and may not be the underlying data. And then once you have all of those articles and you've written your annotations for them, then you can write an outline like you were taught in grade school for writing about kind of what you want to say in a couple paragraphs and the overarching themes that you would like to cover in your background. The second part of the manuscript that uses a literature review is your discussion section. And so the big overarching question here is, so what? So once you have your results, then you want to frame them in terms of what other literature has been done on the topic. So the background literature review, as I said, should already hopefully have been at least partially done. And so now you want to repeat the literature review now that you have your results and see if there's a way that you can frame it and place it in terms of the other literature that's been done on the topic. This is also an important point where you want to start thinking about distinguishing the background and the discussion section. They should be nearly two distinct sections without a lot of overlap. So the background should, again, frame why the research was done, and then with your results, you should be able to put that in context in the discussion, and that's why that kind of area is important. So moving on to our next topic after the literature review is going to be journal selection. So it's going to be important that you remember who is your audience. So it's really good if you can identify an ideal journal that you're going to be writing for. And remember that when you select that journal, the readership of that journal is a specific audience. And so it will help you guide your writing if you can have in mind what journal you'd like to submit to. And on the flip side of that, if you are rejected from one journal and you end up rewriting for a different journal, it may require a significant amount of rewriting with a different focus for a different journal or a different potential audience. And that's going to be really important if you're hoping to get your manuscript accepted to a journal, is that you understand the audience that is going to read that journal. So I'll give you an example of what this might look like. So this study here, a randomized study of training with large versus small vessel size on successful ultrasound guided peripheral venous access, was a study I wrote while I was in residency. And we ended up submitting this journal and getting it published. But you may imagine that this could be submitted to one of several different types of journals. You could submit it to an emergency medicine journal, or a medical education journal, or an ultrasound journal, or a vascular access journal. And each of those journals is going to have a little bit of a different focus and a different audience that you're going to have to focus your writing on. So for example, if you're going to submit this to an emergency medicine journal, they may be more interested in the clinical outcomes of the ultrasound guided IV access. Whereas if you submit this to a medical education journal, you probably want to be extra sure to describe your curricular intervention very well and describe the training portion of this with extensive details in your methods. And then also that's where you'd want to focus the discussion is on, learning objectives and a curriculum and how it fits into undergraduate or graduate medical education. If you were going to use an ultrasound journal, you'd want to focus on, for example, the ultrasound machines that were used, the probes that were used, transverse versus longitudinal approach. Those would be things that would be of note to the ultrasound kind of readership. And then where we ended up submitting this was to a vascular access journal. So you can go read how we wrote it, but in general, what they're going to focus on is the IV technique. And we had to make some edits from reviewers after we had submitted it to focus even more than we originally had on the kind of IV insertion technique, and noting that a lot of this vascular access readership is actually nursing. And so that also is something that you just want to consider when you're writing. So I want to give you a little bit of a framework to think about journals that you're writing for. So this quote here, good, better, best, never let it rest until your good is better and your better is best. They originally said that this was unknown who said this, but I know who said this. This was Mrs. Lopez, my third grade teacher. So she is the one who is quoted here. And this helps remind me of the framework that I use for journals. So there's those three tiers, good, better, and best. There's actually a fourth tier, which is kind of the predatory journal, which you really want to stay away from. And so that's why I don't really mention that. You want to think about kind of the good, better, best, and where you're going to be submitting. So a predatory journal is one that's really just there looking for fees for publication. They're just there to kind of make money. There may or may not be a peer review process. They're often the ones that if you've published before, you'll get emails asking you to please publish in their journal. And the grammar or sentence structure may not be that great in those emails that you get. One way to find this is to look at Beale's list. That's a list of known predatory journals. And another way is to ask colleagues. So if a colleague in your field has never heard of the journal that you're submitting to, or if you've never heard of it, it's possible that it may be falling into this kind of predatory journal arena. And now with the advent of open access, it is tough to differentiate predatory journals from just open access journals, because a lot of the open access journals are also charging fees for publication and submission. One way to differentiate this, though, is to look if there's a fee for a submission. That is probably not something that you want to do. Fee for publication probably is a little bit better. And then we go on to the good, better, and best. So the good journal, the benefits there is you get a rapid review and it's published relatively timely. It has a much higher likelihood of acceptance. And then the better tier is kind of this middle range journal. And then the best is the dream journal, which is one that is highly respected by other experts in the field and or well-read. Only really the best studies are published in journals like this. So an example of this would be the New England Journal of Medicine, or JAMA, or Annals of Emergency Medicine, or Academic Emergency Medicine. Those would be the really top tier journals in the fields that are really, really well-read and respected. I'm going to give you an example of some predatory journals just because I find this a little bit amusing. So these are two, quote, peer-reviewed studies that were accepted. So you can see this first one. I'll let you imply what is written behind the censoring, but this was accepted in the International Journal of Advanced Computer Technology. The entire title, abstract, and manuscript is just this phrase written over and over again. And then this one written below was actually a sort of a sting operation done by people to show that there were predatory journals. So this one was written about Darth Plagueis and the Dark Lord of the Sith and his influence on mitochondrians from Star Wars, those of you who are Star Wars fans. This was accepted to 4 journals. 3 of them actually published it. One of them retracted it after they realized what it was done. All of them said they peer reviewed this. And there is a citation to midichlorians in here about the Dark Lord of the Sith in an actual scientific publication. So again, it's just important to be mindful that you're not sinking money into a publication or something that is not going to be read and not beneficial. What you do want to consider is this balance here of publicity, readership, prestige, versus acceptance, timely publication. And you also might have some personal motives on your CV. And it may be that you need a publication to advance in your kind of next process along the track for along professorship. But you also may want a really well-respected journal to have the publication in. So an example here, I recently published some papers on COVID-19, and those really had some timely, important data in them that needed to be published quickly. So after I got one rejection from kind of a better journal, knowing well that the data I wrote was not of quality to go into kind of those dream journals, I just started going directly to kind of those good journals, looking for somewhere to get the data published so I could get the information out. There's a lot of this preprint stuff that's going on now, which also would be another avenue to consider for that. But those are some important things that you want to consider. The other thing is to consider being realistic about your publication and your data. So your single site survey study is probably not going to get published in the New England Journal. So you're probably just wasting your time by doing those submissions. And then at some point along the line, you may find that you get tired of resubmitting. So once you've had data around long enough, those of us who have been publishing for a while have all had an example of some study at some point where you've submitted it 8 times and it's been rejected 8 times, and eventually you just want to get it published and you don't really care where anymore. You just don't want all that work that you put into getting the data and writing to go to waste, but you've kind of realized the point that most of the major journals are not going to accept it. And so that would be where you'd shift to kind of that kind of good model point on the model, and not necessarily be going after continuing to submit to try and get high impact journals. So the other thing that's super important when you're selecting your journal and when you write your submission is to know the guidelines and the mission of the journal. So know who you're writing to, know what kind of papers they accept. So for example, there are many journals now that aren't accepting survey studies. So it is going to be a waste of several weeks of your time and your research to submit to a journal that's not going to accept the type of study that you're writing for. And then the style guidelines are also really beneficial. And this is one of those tips that I'm going to give you. Follow very closely the style guidelines when you submit to a journal. The editors will definitely prefer that you show evidence that you particularly selected their journal. That can go in the writing in terms of, again, writing to an audience, but also in terms of the style and what they want and how they want their manuscripts formatted. And then the reviewers, whether it's consciously or unconsciously, will also like to see consistency in the submissions and how they review them. If they see something that looks very abnormal to what they typically see from a journal as a reviewer, they may not necessarily think that it's a big deal, but maybe even unconsciously, they may be taken aback by that and have some unconscious bias against what you wrote. So you really want to follow those guidelines really closely. It's going to increase the chance that it's going to get sent out quickly to reviewers and not have to be sent back to you for, the editorial assistant sending you formatting changes and, please change this table and label it differently and things like that. And again, when you have timely data, you really do want to get it published quickly. And so any way you can avoid delays is to your benefit. And it's going to decrease the number of edits that you're going to have to make later. Eventually, it's going to have to be in the format that the journal wants, even if it's accepted. So even if they don't catch it in the first pass, it's just things that you're going to have to change later. And later on in the process, the time frame to make changes gets shorter and shorter when you make publications. So, you submit it for review and they take 8 weeks to review it, and then they get it back to you and you have, 3 weeks to make changes, and then they give you a proof and you have 48 hours to get the proof back. So you want to make sure, again, that you're doing the best you can from the formatting standpoint to get it done up front, because we all have busy schedules and sometimes those are unrealistic deadlines. So we're going to move on to the third area that we were going to talk about, which is putting your pen down to paper. Now, this is one of my favorite parts. I love writing like this. And so I do have one big tip to start this section off. And that big tip is that writer's block does not exist. You are psyching yourself out when you think that you have writer's block. You really just need to get something written down. And this is often the hardest part for many people, is to just get something down on paper. You can always edit it later. You can always remove stuff. You're not signing your life away when you write a draft of a paper that it has to be that way. But it's almost one of the biggest areas that delays getting things written is people are just afraid or feel like they're unable to write stuff down. And I would strongly encourage you to just get something written down and let other people edit it. This is one of my tips to success is getting it written down, and don't take any offense when people edit it. I wrote a draft. You can edit it as much as you want. I think people in general are much more willing to make edits than to write stuff down. So if you can be the person in your group who can get it down the first time, I think you'll see a lot of benefit to that. Now, what are we going to write? This goes back to that IMRAD format we were talking about. So that stands for Introduction, Methods, Results, and Discussion. And I think many of us are familiar with this if you've done any research writing before. Kind of answers the questions why, how, what, and so what. So once you have the results, you have everything that you need to write your paper. You just need to put it all together. And so, again, it's really important that you get a first draft down, and then you can edit liberally. And so having others' proof is really helpful. If you're going to have different people in your research team writing different sections, it's going to be important that you have a coherent article at the end. And so you make sure that you have people read through it and make sure that it's not choppy. It's not like very different writing styles that's very clearly from different people. And then having other team members or even colleagues not involved in the project edit your paper will be of so much help to you. So you've been, as I mentioned before, you may have been intimately involved in the field for a while or just intimately involved in the project, and your writing may reflect that. And so you may have implications that are very clear to you because you were involved in the project, but may not be clear to someone who is not involved in that project. Or you may be using jargon that other readers, even other medically trained people, don't understand. And so a fresh set of eyes can really help combat that. And again, especially even if it's someone not involved in the research at all, but definitely at least another person to edit it. And as I said before, it's really important that you remain open to edits and not defensive. I find myself initially, I have to take myself back sometimes when I see edits and I'm like, well, that's so clear. I don't understand why they didn't understand that. And I think being really open to edits, because if somebody who is not familiar with your project is telling you they don't understand something, you should strongly consider the fact that many editors, reviewers, and readers of your paper also will not understand the way that you've worded it. And so it's important to consider that. Now, is it possible that it's just a one-person thing and that what you wrote is perfectly fine? Yes, but I think you should consider that the exception and not necessarily the rule. And you should, again, take edits with a degree of openness. And for those of you who are looking for someone to, outside of your project, to revise your paper, I love doing this stuff. And so I will more than happily volunteer without any need for compensation or anything. You can contact me. My email's at the end. I will happily edit papers for you. So now we're going to go on to some of my personal tips and tricks for writing papers. My first tip and trick on this page is about the length of the paper. So most people write their papers in a length that's shown here. So they have about twice as much in the introduction and discussion and as they do in the methods and the results section. I would strongly encourage you to kind of flip that around. And so you will find that well-written scientific research should have the methods and results nearly twice as long as the intro and discussion, noting that you can have results in tables and figures and stuff. But I think the really lengthy introduction and discussion for a small, I keep using this example, but a small survey study, really you're writing an editorial and just happen to have a survey along with it. And really, if you're presenting quality research, you should let the research stand for itself and you just frame it minimally. So I'm going to move on to some specific tips and tricks for each section that you can consider. So for the introduction section, I really want to stress a broad and well done literature review. And be sure to differentiate the background kind of why versus the discussion. And then you also want to show why your article is unique or needed. And really important, again, this goes back to what I said before, is to keep your introduction brief and to the point. You need to know your audience. So I'll give you an example. If you're submitting to academic emergency medicine, you don't need 3 paragraphs explaining the pathophysiology of sepsis. The readership of academic emergency medicine knows that well, and so you don't need to waste word space in your introduction explaining that. You can touch on it briefly based on what your research is on, but you don't need to go explaining that very long. Or if you're writing, for example, for a medical education journal, so we'll use academic emergency medicine education and training. Most of the readership there are going to be people involved in residency training programs, so they know what a milestone is, and they know what the ACGME is, and so again, you don't have to necessarily spend time describing that. The next section that you're going to get into is the methods section. So the most important part of the methods section is details, details, details. You want to have your methods be detailed enough to be repeated, and this is down to the finest details of the project. We all know that replication is an important part of the scientific method, and so you want to be able to describe what you did. So if somebody changes something minor and gets a different result, there's a reason that they can identify for it. And along that line, the context and setting is also really important. So for those of you in academic emergency medicine, are you in a truly university-based academic setting? Are you in a community setting? Are you with residents? Do you have mid-levels or advanced practice providers? How many beds do you have? How many patients do you see an hour? How many patients does your department see a year? And then also, you want to make note of an IRB. Almost always have to have an IRB mentioned in your method section. And then the other point to be really clear that I sometimes see a lot when I'm reviewing papers is the results go in the results section. And so you don't want to start mentioning your results in your methods section. So a sample size would be an example of something that often ends up in the methods section and kind of doesn't belong there. So you want to make sure that you're separating your methods and results. Metrics of a specific tool that you tested, for example, of a survey or something, that also should probably go in the results section. Speaking of the results section, give you a couple tips about writing in the results section. So almost all scientific papers are going to want the demographics as the first kind of couple sentences in the results section. And I would recommend that you use tables and figures very liberally. If there are paragraphs and paragraphs of results and text and number dense text, it's not really easy to read. And so you should really consider, based on the kind of journal guidelines, if there is a way that you could take your paragraphs and remove a paragraph and turn it into a table. It's so much easier on the readers and the eyes and people understanding your data if you have a table or a figure available. The demographics is a really good example of that. You can almost always put that in a table unless it's very minimal. You probably want to try and put the demographics in a table for the age and the gender and the PGY level or some other example of the demographics that you're going to be including. And then the other thing that's important in the results is that you have methods for all of the results. So if you're going to report a statistic or something, you really want to have that mentioned somewhere in the methods of how you got that, including the statistics, but also how you calculated whatever results section you may see. So every once in a while, I see someone bring up something, inter-rater reliability or some other thing that was never mentioned in the result or in the methods, and you really don't have any clue of how they did it. And again, that's going to be an important thing. And the vice versa of that is true. If you have a method that you say you're going to do, you also want to have a result that corresponds to that. Now, moving on to the discussion, which is, again, one of the really fun parts to write. This is really your chance to put your research results in the context of what else has been done. So remember, this is the so what of your research. So in the beginning, you want to maybe 1 or 2 sentences to summarize the results. You do not want to use your entire discussion section to just restate the results all over again. That's why you have a results section, is to have the results in the results section. Use the discussion for exactly that. Use it for discussion. If you don't have anything more to say, that's fine. You don't have to have a lot to say in the discussion. As we talked about before, shorter is probably better. And so you don't have to fluff out a discussion to make it, 10 paragraphs long. Say what you think is important and then be done. Some of the really well done research studies have really short discussions because the results speak for themselves. And then I think the other thing that you really want to be mindful of is thinking carefully about all the limitations for your project. and be humble and realistic about what is a potential limitation for your project. You may want to list what you did to counteract that potential limitation, but you really do, this is, people get into trouble when they miss limitations or overstate their conclusions. And so you want to be very mindful and think about what are potential limitations. Common ones being generalizability. So if you only did it in one geographic region or one center, generalizability is often an issue. You may find that you have bias in your studies, whether it's gender, race, age, that also may play a role. And those are just some common examples. There's many, many others that are also a potential, dependent on the type of study that you did. And then the last part of the discussion that you want to have is kind of a future research section. So you want to talk about what your results mean, what people can do with those results, but also what researchers should be doing in the future. So think about maybe what you want to do next as research, or what you would have done if you had unlimited time, money, resources, whatever kind of was a limitation. What would you have done different in your study? That can help you get a limitation, but also can help you write about some future research. And again, what could be done to counter the limitations that you have? So sometimes a randomized controlled trial is just not ethical or never going to be done. So, I think the one we talk about a lot is, parachutes of jumping out of a plane. It's just never going to be done. And so that's an important thing to realize as far as, when you're writing what future research could be done or what are the limitations of it. I think, a randomization of epinephrine for anaphylaxis, I don't think that has ever been done either, but I don't think anyone would ever consider doing that. So to say a future research needs to be done on something that can't be done is also, you don't necessarily have to do that as well. And then the last section is your conclusion. This should be maybe one paragraph, maybe two, not very long. And you definitely need to limit to the results of your study. So often I see conclusion sections that are, that you did a small single center study and, therefore XYZ should be the standard of care. If you did a non-inferiority study of drug A versus, commonly used drug A and less used drug B and showed, no difference in efficacy, you'd be overstating your conclusions to say like drug B should be the standard of care for, whatever condition that you're studying. It's really important to realize that and focus on just what you present in your paper for the conclusion. Your discussion, you can talk about how it fits in with other areas of research, but in the conclusion, you really want to focus on what's in your paper and what your results in and of themselves standing alone show. So once you've got your paper written, then you have so you don't want to restate the introduction and the conclusion either. You want to rewrite a conclusion that kind of can stand alone. So what's next? Some things to consider. Author order. This is something that, again, there's a couple different kind of presentations that have been on, and everyone has a little bit of a different view on this. We had a recent presentation on this that I was really intrigued by. I think this should probably have been discussed early on. I'm a big fan of early and often discussions about author order and when it's going to change and why it's going to change. But you need to revisit this before the submission. So before you submit it, you need to make sure that everybody's on board and that everybody agrees with kind of the author ordership based on whatever you've discussed before. It can sometimes be a contentious topic. I've never had an issue with it, but I know that it has turned into issues for people before. And so you just want to consider that. There's the ICJME, International Committee on Journal of Medical Educators, that has some criteria for what meets authorship. And then you can use a score-based method to determine who's going to be an author. I oftentimes use, who's going to benefit the most. I use that in addition to contributions. So for example, I work out in the community and I'm not on a tenureship track or anything like that. So if some other trainee or someone wants to have a first publication, I'm more than happy to let them do that. I don't have a great interest in it, assuming that we all put in, somewhat equal effort. And often you'll find that the trainee or the medical student or the resident puts in a lot of effort. And so you probably want to recognize that where you're able to. But that being said, if you feel that you need it for some promotion or to get the next grant, or, speaking of benefits, you may just think that your expertise will be more likely to get the paper published. And so having you listed as a first author will do that. And that's okay too. I just think you need to have a group conversation about that. And again, approve that before you submit. And then the other thing that's really important the entire submission has to be approved by the team before you put it in. So you really want to make sure that you have sent it out to everyone to have team approval. The submission process can actually take a little bit of time. So you want to make sure that you dedicate maybe an hour or so to get it actually submitted into the submission system for the journals. Most journals have editorial management systems nowadays. But that process, if you've never submitted to that journal before, can take a little bit of time to set up an account and get used to what they want submitted. They're all somewhat similar, so once you've done it a couple times, you can get used to it. And some are a little bit easier to manage than others. And then what's really great is to consider the kind of revise and resubmit. So a revise and resubmit from a journal is a success. Out of the 50-some publications I've had, I think 2, if I'm remembering right, have been accepted on face value without any revisions requested. So if you get a revise and resubmit from a journal, that is a win. So I don't think don't expect to just get accepted as is. That would be a very rare exception. And there's a separate research learning series also that's going to be on peer review and how to respond to the revise and resubmit and peer review. Some of my recommendations would be open to reviewer suggestions. Just like I said before, when you have your colleagues editing your paper, be open to your reviewer suggestions and change if you're able. If you feel very strongly that something is incorrect from a reviewer or doesn't need to be changed, you can mention it, but you generally want to try and coalesce to what the reviewers are wanting. I'm very personally particular about grammar formatting, and so I personally like have stuff changed, but sometimes you have to realize that that's not your hill to die on. If a reviewer wants a word choice different or some grammar thing a little bit different, sometimes you have to realize like the bigger picture is to get it published, and so you can just coalesce to what they want. If you are going to revise and resubmit to a different journal, I really think you need to remember that you need to remember the revise portion of that. So if you got your paper rejected and it was sent to reviewers and they sent you comments, you should read those comments and edit your paper accordingly. They were given to you so that you can improve your paper. And it will make your paper better because obviously some reviewers or experts reviewed it. It's more likely to be accepted at the next journal that you submit it to. And then the really important thing is what you'll find is it's a small world, and I've seen it before. You might end up with the same reviewer at a different journal. And there's no faster way to get your paper rejected than to submit it unchanged from the last time you submitted it to a different journal to the same reviewer. So you just want to be mindful. And again, be humble and consider that, there are changes that you can make to your journal. And some of the changes may be things that you can't do. It may be, you need to redo your study all over again, and maybe you're not willing to do that, don't have the time, resources, or it's already done. But in terms of writing and changing things around, you definitely want to strongly consider that. So that's what we have on drafting your manuscript. So in summary, I think you need to be mindful to know your audience and write specifically to the audience that you're writing for. Writer's block does not exist, so please, please, please get something written down, and then you can revise liberally after that. It's really important to get it written down, though. And then remember that rejection is just another opportunity. It's another opportunity to change and revise and resubmit. There is data out there that if you submit it enough times, eventually your paper will get accepted somewhere. So just think of it as another opportunity. Don't wallow in your sorrow of your rejection. So, anyone have any questions, comments, concerns, opinions, anecdotes, monologues, diatribes, or riddles? You can email me, jjdavis@vituity.com. Otherwise, I'm going to say that this is El Fiend. Thank you so much for coming and listening to this. And again, I'm happy to take any questions if you want to email me, and or if you have anything specific about a specific project that you want me to review. Thanks again.
All right. Thank you, Dr. Davis, for this very informative presentation. And thank you to everyone watching this presentation for the SAEM Research Learning Series. Have a great day.